Okay, so look, today I'll be talking about 3D printing. I'm sure you've all seen some 3D printing around, but what's been changing is our ability with 3D imaging to get 3D prints of actual clinical scenarios. You're going to see a lot of 3D echo today, but I guess 3D echo has opened up the ability to get 3D imaging from echo. MRI, I think everyone is aware of, so 3D angiograms, very easy with MRI, and there's a number of other sequences we can use. And look, my own interest is in CT, and I think that CT is underrated in terms of looking at valve and valvular function. So just as an example, this is a functional CT. It was taken with a sort of a newer machine, like a wide volume 512 slice. But this functional CT was 1.1 millisieverts, so you don't need a lot of radiation with some of the newer CTs, and you get excellent image quality. And we'll talk a bit more about that later. So one of the key things is if we're going to do modelling or 3D printing from imaging data, we need really good data. And if we're doing complex congenital work where we want to use really low radiation doses in younger people, we need to use all the techniques that we've got. And there's one option is that we'll have a look at is this thing called 4D image processing, where we get multiple imaging time points and we combine those time points to reduce the image noise. And we'll see some examples of that in a moment. So in terms of the steps that we need to go from an image to a 3D print, the first step is we import our DICOM images, and then we have a process called segmentation. And segmentation is really just telling the computer what we want to be included in the print and what we don't. And there's various software platforms that will allow us to do that. After the segmentation, we'll probably end up with a file that looks a bit like this. So this is a zoomed up section of the right coronary artery coming out of the aortic sinus, and this is called an STL file, and this is a really common file format, and it's got lots of little triangles, and this tells us what's going to be printed and what's not going to be printed. Now, unfortunately, this is what a raw 3D echo might look like. And I don't know if you can recognise that, but this is the mitral valve orifice here. And what's worse is, particularly with echo is not, the data set is not isotropic. So you don't have the same voxel dimensions in all directions. And the further away you are from the echo probe, the bigger the voxels are going to be. So if you are going to start with 3D printing, echo is a difficult modality to start with, though it's certainly possible. Now, one thing to have a look at, so this is one thing to consider carefully, is that you can't print what you can't see. So this is a zoomed up picture of a neonatal MRI of a patient with complex congenital heart disease. They've got a stenosis of a misplaced pulmonary valve here, and there's lots of black areas here and black areas here, and it takes a lot of expertise to work out what is artifact and what is real, and where exactly all the anatomical structures are. So the 3D printing, particularly in this scenario, is not something where you can just press print and something will come out. You need to have expertise and supervision, particularly in areas where what you produce is critical. And as I can say from experience, surgeons don't like it when there's a VSD in your model and there isn't in real life, or vice versa. So once we've got our 3D file, it might be a file called an STL file. You might need to do some repairing or fixing up of that file, and there are lots of different file formats. So for example, if you want to do a colour 3D print, so I've done some colour prints of a heart, you might use a different file format where there's a colour map which is imposed on your 3D model. So lots of different file formats. This is your kind of 3D printer that you can go down to Officeworks and buy, and look, it works okay. But there are multiple different kinds of printer. This one takes a bit of Lego plastic. The Lego plastic goes into a heated chamber. It warms up, melts the plastic, and it lays it down layer by layer, creating a heart model. So there are some pluses and minuses of that way of printing, but there's a whole lot of other different ways. So you can have a laser that fuses bits of plastic together. You can have a laser that gets a photopolymer to stick together. And there's also multi-material printers. So printers that can print down rubber-like material, hard material, and multiple colours. So 3D printing can do a lot of that. If you go outside, there's some examples. Nicolette, a hardworking honour student, has been doing some 3D printing of mitral valves, and we've got examples of many different kinds of 3D prints. And this is some anatomical specimens of a mitral valve which have been CT scanned, and we can 3D print those for teaching, and that's very easy to do. So why do we want to do 3D printing? First thing I'd like to say is that, look, 3D printing has been around for a while. So Jared Grill was doing some of this 3D printing back even in 2007. Look, we can use it for bench testing. So for example, we can 3D print a patient's anatomy. We can practice putting in here an aortic stent and see how things fit before going into doing that procedure. We can use it for teaching, and you can go, there's an NIH 3D print collection. So you can go to their website, you can download one of these 3D files and print out a congenital heart for your own education or for someone else's. And we can use it for sizing, for example. So I've done a little bit of 3D printing here for ASD Closure sizing. Congenital heart disease, though, I think is where mostly it is going to be used. This is a very simple case of a very small ASD. And just to illustrate, this was something that I printed for a conference. So before getting on the plane, I uploaded it to Shapeways. I paid $35, and 3 days later I was in the hotel room. So it's 3D printing can be done very routinely now. And as I mentioned, where this is clinically being used currently is predominantly for paediatric complex congenital heart surgery, where, especially overseas, it is being used for planning some of this complex surgery. And here, look, I have used it for procedural planning. So, for example, the left atrial appendage, as you probably know, comes in a variety of different forms. Some are much bigger, some are much smaller. It can be hard to size some of the closure devices. So what we did is 3D printed the left atrial appendage out of a flexible material mimicking the appendage. And then we can just put in devices of different size and see how well they fit. And taking that one step forward, we're able to rescan the model and see exactly how much strain each different size device places. So a small device, there's no radial strain. That device is going to dislodge very easily from the appendage. And conversely, the very large device didn't collapse properly into a stable conformation. And one of the barbs is placing a lot of strain on the wall of the left atrial appendage. And that may be one of the factors that can cause pericardial effusion or tamponade. So I've been talking a lot about CT printing, but of course we can do this from echo. So here we've got a patient with a P2 prolapse, which I've printed in a flexible-like material. But if you go outside and have a look at this material, you can see that it's still a long way away from a real mitral valve, what a real mitral valve feels like. And so outside, Nicolette has been doing some studies, so doing prints from 3D echo and 3D CT. And here is a CT where we've used a multi-material print. So this is calcification affecting the annulus and also the valve, and the rest of the material of the valve is printed in a clear or flexible material. And if you have time, I'd be very grateful if you go out and have a talk to Nicolette. She's got a survey just to see, is this useful or is this not useful? And I'd be very grateful for all of your opinions. So 3D printing is one thing, but once we've got that 3D data, we can do whatever we like with it. So we can apply pressure to a 3D model and see what kind of stretch we'll get in the aorta. Here I use some MRI data of a coarctation, and we use the same data for flow, and we can simulate what the pressure gradient is across that coarctation. But where I've been using it recently is for mitral valve, percutaneous mitral valve. So this is a Tendyne valve. This is a 4D CT using this 4D denoising technique. This is a Tendyne valve that's been placed within the mitral valve. So the way that this is placed is through a direct puncture of the apex here, and you can see that the tethering structure that's holding the device in place. Now, one of the potential issues that can come about with this device is if the device is relatively too large, we can get obstruction of the LVOT. So again, having a look up into the mitral valve, this is the LVOT and the aortic valve here, and there can be potentially obstruction of this area here. So, and it's always good to know about that before you put the valve in. So what we've been working at doing is virtually implanting one of these mitral valves in. So we have a 3D file of the structure. We virtually implant it into the ventricle. We need to apply various sort of conditions to that simulation. And then we can simulate what gradient and what effects that mitral valve will have. So we can virtually do the surgery, ensure that the device is correctly sized and will be safe in this patient. And as I said, we can calculate the expected gradient, and so far it looks like it's working quite well. There are lots of other forms of modelling we can do. Again, this is a 2D simulation, but 3D simulation of mitral flow inflow can be used, and we can compare that again to sort of 4D flow data from MRI. So really, 3D imaging is the key. So as an illustration, this is an MR angiogram, and it's been rendered to look like it's 3D printed, rendered to look like it's maybe made out of wax, but we can change that rendering to make it out of glass. And when we have that 3D data, we can then simulate, for example, blood flow going through that glass structure. Once we're able to capture the 3D data from echo, MRI or CT, we can 3D print the valve, or we can model it, and we can do our procedures through that. And this data comes from a colleague at the Art School of Uni of New South Wales. So just in conclusion, if you want to try some 3D printing yourself, there's an open access review article that's going to be available next month. If you're in Sydney, right now there is a 3D exhibition at the Powerhouse Museum. I've got a couple of hearts there, but there's lots of really interesting stuff, people 3D printing snail shells and other things. And I'd like to thank all of my colleagues who've helped with this.